It's not just doctors and patients that you see this sort of an issue with. Lately, we've been seeing an enormous number of, an alarming number of cases of teachers and students who are having sexual relationships. And in many of those cases, as they go to court, the reasoning that is applied to it is the student pursued the teacher. So the teacher doesn't think that that's not okay. Much like the case of a minor and an adult having sex with each other. My hands are in weird places in this camera. Much like a minor and an adult having sex with each other, it is presumed that there is an imbalance of power in this relationship. The person who has the power has all of the control. The person who doesn't have the power is presumed to not be capable of consenting. And that's the key. A teacher and a student, a doctor and a patient, an employer and an employee. One of those people has power. The other one does not. And when the one who doesn't have power is the one who does the pursuing, who does the chasing and the asking and the seducing, and then the person who does have the power eventually says, okay, this seems like a thing that we should do. That's the person, that's the moment that the mistake was made, and that's the person who made the mistake. It is always the person who has the power. So never forget that. In your medical practice, you are the person who has the power. We've known each other for a while. We've been friends for a long time. And then I became an acupuncturist, and so I started treating him in my practice. And then we became romantically, sexually involved. It's the same sort of thing. I tell my students in class, you can treat the people that you have sex with, but you cannot have sex with the people that you treat. And that is an important distinction between in the time frame. If the patient relationship precedes the sex, then you are guilty of sexual impropriety. If the sex precedes the acupuncture, the treating, the doctor relationship, then you're okay. I would, however, caution all of you and anyone who is a medical practitioner that chooses to treat people that you are personally or romantically involved with. Things change. Things change over time, which is actually, I think, the very next slide. Oh, no, that's not the next slide. Oh, but I love him, or I love her. She loves me, and it's the most romantic thing in the world, and my life can't happen unless this person is part of it. Oh, Michael, that's an excellent question, and I'm going to get to that in a in a few minutes. There's a way to manage this issue. If you encounter a patient and somehow decide that this is the person that you have to have for the whole of your life, and you can't live without them, then you can do that. But first, you have to end the doctor-patient relationship. And all of the medical professions are very clear about this. There has to be a clear cessation between the medical relationship, and there has to be a clear period of time between the cessation of the medical relationship and the start of the personal relationship. The only medical profession that actually has a defined time frame for that is the psychiatric profession. And they say 6 months. So much like the AMA's definition of what sexual impropriety or sexual misconduct will be what defines that concept for you as an acupuncturist. This is the place where a time frame is written. It is most likely to be the time frame that is cited in a case. So if you have to have a relationship with somebody that you met as a patient, that came into your your office, and that is the initiation of your relationship was treatment, then you have to stop that doctor-patient relationship, refer them to another practitioner, ideally one that's not in your own medical office. And for a period, I would recommend of at least 6 months. There's no contact between you. It's not like you can say, okay, today is Tuesday, I'm treating you today, this is the end of our doctor-patient relationship. Do you want to have dinner tomorrow? And we can have dinner all of the days between now and 6 months from tomorrow, and then we can have sex. No. The entire relationship there has to be no contact, no relationship at all between the two of you in the cooling off period, as it is called in many medical professions. And I think that what you'll find in most cases is it wasn't worth it. That person is not your soulmate, is not a person that you can't live without. Most people aren't willing to wait 6 months for you.